Good morning and welcome to another edition of Wellness Wednesday. I am your host, Christy Lau, and I am so happy to be back with you for another episode. I wanted to wish you all a happy Diabetes Prevention Awareness Month as we usher in the month of November. And that's really going to be a focus for us today on Wellness Wednesday. As you may know, Wellness Wednesday is meant to just be a short burst of something fun, something entertaining, maybe an opportunity for you to get to socialize with others during what may be a very trying time during the pandemic. Just a few housekeeping tips. Everybody has joined the webinar in mute and in listen only mode, but that does not mean that you will not have the opportunity to ask questions of our speaker today. You may be able to see the chat or question and answer. It may say Q&A function in Zoom, and that's where you may enter any questions that you may want to ask. Once she finishes her presentation, I will go ahead and I will curate those questions for her, and she will address those as best as humanly possible. So, without further ado, I want to introduce today's speaker, Christina Camargo. She's the project manager of the Diabetes Prevention Program in the Community Wellness Department of Partners in Care Foundation, which is a sponsor for Wellness Wednesdays. Her journey with Partners started as a participant when she first took her mother to a falls prevention program led by volunteers. It helped her mom so much that Christina decided to become a Partners in Care volunteer, and then eventually joined Partners as a staff member in 2018. Christina is a certified lifestyle coach of the CDC-approved weight loss program Prevent T2, and is also a facilitator of other evidence-based wellness programs. She is passionate about connecting workshop participants with powerful tools that are proven to prevent or delay type 2 diabetes. So without further ado, I want to turn it over to Christina.
Thank you, Christy, for the warm welcome. Hi, everybody. So today it's our Wellness Wednesday, and as Christy mentioned, it is Diabetes Awareness Month. So I wanted to talk about what diabetes is and what is pre-diabetes, and also what we can do about it. Next slide, please. All right, so diabetes is a loaded term. It is a condition where it affects a lot of different parts of our body. So basically, it is when our body cannot process sugar effectively. So the sugar gets stuck in our blood and cannot get into the cells. So when that happens, we get fatigued because the cells are not getting energy, and then the sugar level gets really high in our blood, and we're not able to have insulin to help use that. So it is not a fun disease at all. It also has a lot of different complications that can happen later on. And so it could affect our nerves. It could increase our risk of heart attack. Also our kidneys, our eyes, our feet, our gums, and even our skin. So, but there's good news, because if a person is borderline or pre-diabetic, there is definitely things that we can do to turn away from becoming diagnosed with diabetes later on. So next slide, please. So here are some numbers. Over 34 million children and adults in the United States have diabetes. So we can talk numbers all day. 34 million, 100 million, what does that mean? That comes out to about 1 in 10 Americans. That's 10%. That's a really high number. And then the next key fact from the American Diabetes Association tells us that 1.5 million Americans are diagnosed with diabetes every year. So what that translates to is 1 every 21 seconds, someone is hearing from their doctor that they have been diagnosed with diabetes. And the last key fact nearly half of American adults have diabetes or prediabetes. And also, 1 in 4 adults age 65 or older have diabetes. These numbers look really grim, and I just wanted to address that again. If a person has been diagnosed as prediabetes, there's something definitely that we can do with lifestyle changes to turn away from becoming diabetic later on. Next slide, please. Diabetes is expensive. Individuals with diabetes have 2.3 times higher healthcare costs than someone without. And also, 1 in 7 total healthcare dollars is spent treating diabetes. And as a total economic burden in 2017, out of which 327 billion is from diabetes, and then of that, $90 billion is in reduced productivity. So diabetes is a very expensive disease. Next slide, please. So we talked about diabetes, but what is prediabetes? It is actually a condition. So for those of us who have heard of high blood pressure, when we go to the doctor's office, when we get our blood test, when we get our examination, some people may have also heard of borderline high blood pressure. And when it comes to diabetes, some people have also heard of, oh, you're borderline diabetic. What does that mean? Well, it's not just borderline. Prediabetes is an actual diagnosis. It is identified when your blood sugar level is higher than normal, but not high enough yet to be diagnosed as type 2 diabetes. So numbers again, 86 million adults have prediabetes, and that is about 1 in 3 Americans. And 9 out of 10 people with prediabetes don't even know that they have it. So for those people who have the condition without lifestyle changes such as weight loss and moderate physical activity, in 5 years' time, 15 to 30% of those people with prediabetes will develop type 2 diabetes within 5 years. So next slide, please. But there's something we can do about it. There's something, it's not all out of control. It's all about balance. With lifestyle changes such as diet, weight loss, and also activity, we can turn it around and, don't go down that road to diabetes. Next slide, please. So I want to talk about briefly the CDC diabetes prevention program. It is kind of like Weight Watchers, but it's free with insurance approval, or in certain cases that we are offering scholarships as well. So part of the program, it's about setting goals. And one of the goals is on physical activity at a moderate pace. And we are aiming for 150 minutes a week of moderate paced activity. And if you break that down, 150 minutes may sound like a lot. It's 2.5 hours. But if you break that down to 5 days, it's only 30 minutes a day. And if you break that down even further, if you do 10 minutes in the morning, 10 minutes at lunch, and then 10 minutes in the evening, it all adds up. So next slide, please. So here's a quick question. We want to take it one step at a time. So here's a statement. Physical activity, it's only effective if you do it for more than 30 minutes at a time. Is that true or false? So take a moment to think about that statement, and then we'll go to the answer. Next slide, please. If you answered true, that is actually not correct. You don't have to do all of your daily physical activity all at once. We can split that up into 10-minute increments or 15-minute increments. It all adds up. Next slide, please. That's right. Do what you can when you can. We talked about splitting up the activities into 10-minute increments or 15-minute increments. Just like when we eat, if we break a cookie into 4 pieces, you're still eating the entire cookie by little bites, but all those calories still count. So same thing with activity. You can split up. You don't have to, do 2.5 hours of activity all in one sitting. You can split that up. Next slide, please. And here are some tips on how to save calories. My favorite one, it's the top left corner. If there are soda drinkers out there, replacing one regular soda every day with regular or carbonated water, you could save over 1,000 calories in a week. So that is huge. That is huge. 1,000 calories in a week, it's a lot of calories. And then on coffee, if you drink 2 cups of coffee per day, skipping the milk and sugar could actually save 966 calories in a week. So it all adds up, right? On the top right, flavored yogurt with those fruit on the bottom actually packs a lot of hidden sugar and calories. If you switch that over to plain fat-free yogurt with a 1/4 cup of fresh fruit, you could save 623 calories a week. And then last but not least, on the bottom left corner, potato chips is one of my favorite snacks. And but I know that it's not good for me. It is fried. So I'm trying to do substitutions right now. And I have found that I cannot go all the way to carrots yet. I am in the middle. So what I'm doing is I'm doing baked chips, and I'm also doing Triscuit and also popcorn. So I crave that crunch, but I'm looking for healthier alternatives. And hopefully one day I can switch over to baby carrots, and that would save me 291 calories. Next slide, please. So for breakfast, I want to talk about starting small. What is a typical breakfast that you are eating right now? So start thinking how you can level up to the healthier alternative. So for me, I started with plain yogurt, but then it was too boring. So I started adding granola. I was experimenting. I also added like Cheerios to it. And then slowly I added some nuts and then also some bananas. So now it's a lot more interesting. And cinnamon sugar is another one of my favorite for the colder months anyway. And then for summer, I go with yogurt, and then I also do fruit, apples, bananas, and that cinnamon sugar again. And then another one of my favorite, it's frozen berries. I use that on top of either my yogurt, or when it's colder, I add that to my oatmeal as well. Next slide, please. For lunch, here are some healthier alternatives. This is a slide on building a better salad. So it's not all about vegetables. You can have some fun with your salad too. So start with a base. You can use mixed greens or baby spinach, and then add your protein, but please double check the serving size. So you can do shrimp, baked chicken breast without skin, and also some turkey. Have different varieties so you don't get bored. Fruits and veggies are actually really interesting to add to a salad. With chicken, sometimes I add apple slices, and I haven't tried pears yet, but I think grapes is also a good addition. And then on healthy fats, you can try pumpkin seeds, chia seeds, or other nuts. That, but you have to watch the serving size as well. 2 to 3 tablespoons would give you enough healthy fats, and also add that crunch to it. And then last but not least, I used to just add dressing, drizzle it all over my salad without even thinking about how much I'm using. But a good way to watch your calories is limit it to no more than 2 tablespoons total. You may not able to cut it down all the way when you first start, but it's easier if you just go slow and do small steps. So, and I always have it on the side now, so I know how much exactly I'm adding to my salad. Next slide, please. This is something that I did not know before I started training for this diabetes prevention program. So for someone who is on a weight loss journey, um, I did not know that keeping a food log can actually double a person's weight loss. So in this study by Kaiser Permanente, participants who tracked what they ate every day were more successful in losing weight than those who didn't track their food. So tracking our meals is a very important part of this program, because without tracking, you won't even know what you're eating, or you won't even know your portion size or how much calories you're taking in. And nowadays, there's a lot of different applications online and also on our phone that can help us figure out how much we're actually eating. So there's also a saying on mindful eating. Um, Eat with the intention of feeling better than before we eat. So I think a lot of us can think about that heavy meal of spaghetti and meatballs. So when it's all carbs like that, after we finish that plate of spaghetti, a lot of times we feel bloated, we feel heavy, we're tired, we don't have any energy. So that is very similar to when we get sick. Except for the sneezes and the coughs, we kind of feel the same. So a lot of times we don't realize what we eat actually can make us feel not so good and may even make us feel sick. So, one way to balance it is to add salads and vegetables to the spaghetti meal. And then instead of meatballs, we can try substituting with a lean turkey, ground turkey, that is low fat. And with the salad and vegetables, you will have a complete meal without feeling hungry. Next slide, please. So again, I want to talk about a little bit on this diabetes prevention program. Um, It is a 1-year program with 26 sessions. So the first 16 weeks are weekly sessions, and then we taper off to one meeting every 2 weeks for 4 meetings. And then we switch to one meeting every month for the last 6 months. And that would take us through the entire year. And for those participants who attend more than 17 sessions, they lost nearly 5 to 7% of their weight on average. And also, research shows that a structured lifestyle intervention can cut the risk of type 2 diabetes in half. So, it is not out of your control if you have pre-diabetes. It is, you are able to make changes and don't go down that road of type 2 diabetes. Next slide, please. So, what does this program what does this program have? So I'm a trained lifestyle coach, and we would have small group meetings, and it's a curriculum based on CDC's approved curriculum. And in the small group setting, we're meeting over Zoom over the course of a year, and everybody support each other and have ideas. We trade recipes, we trade tips, we go over what works, what doesn't work, we make action plans, and it's a 1 hour meeting every week for the first 16 weeks, and then it tapers off. So I want to encourage everybody to make healthier lifestyle choices, and also do something good for your bodies, and commit to yourself, commit to your goals, and also commit to a healthier lifestyle. Next slide, please. All right, think about that keyword balance. Take that through your day, your coming weeks, and your coming year. So it is all something that it's easy to incorporate. Think about how much time you spend on eating your meals. For example, breakfast maybe 25 minutes, lunch maybe half an hour, dinner maybe 45 minutes. So that's easily over 2 hours a day on food. And that's not including prepping or going shopping or even ordering online and going to the fast food restaurant and waiting in the drive-through. So we spend a lot of time on food, but how much time are we spending on exercise, right? If we're just setting a goal up to do 10 minutes 3 times a day, all of a sudden that doesn't seem so bad. So it's something to think about on balance. So with that, I'm going to close and hand over the questions to Christy.
All right. Thank you so much, Christina. That was such helpful information and so insightful with some really great tips. I now want to open it up to the group for any questions. Again, you can use the chat function or you can use the Q&A function here in Zoom to relay your questions to myself and to Christina. And what I'll do is I'll go ahead and I'll read them off and Christina will answer them. So opening it up for questions here. And while we're waiting for those to come in, I've got a question. What's one way that you found to incorporate, small bursts of exercise into your day instead of doing it all at once?
That's a great question. So I just learned that 2 minutes of activity every 30 minutes will help us increase circulation. So I've been doing some chair exercises. I'm doing some ankle circles. I'm doing some wrist circles. And I'm also doing some stretching. And you can also do marching in your seat or standing up.
Great. We have a question that came in that says, where can we sign up to be in the prevention group? So I believe the diabetes prevention program.
Yes, at the end of this presentation, Christy will share a email address. So please send an email to sign up for this program.
Somebody is asking, is this recorded so we can see it again? Yes, absolutely. We have actually recorded every episode of Wellness Wednesday with the goal of posting it in a space where it can be viewed by all. So yes, absolutely. You'll be able to view this again and you'll be able to share it with your friends so that they can see it as well. Thank you for those questions. Other questions, please feel free to enter them into the chat or into the Q&A function. Somebody asks, does eating beans raise blood sugar too much?
It's all relative. So everybody digestive system, it's different. So there are different calculators out there. So there's a calorie calculator to figure out how much calories you need a day, and then out of which you can figure out carbs, proteins, and fat. So it depends on how much servings you're eating and how your body processes it. So it's good to experiment. Start small, start with half a serving, and then to monitor your blood sugar, it is very important to keep track of it before you eat, after you eat, maybe about 2 hours, and then do the comparison. And if you have any questions, please check with your healthcare provider.
Thank you. Another question here, is there a cost to be in the prevention program?
There is a cost, but depending on your insurance, you may be able to qualify for free. So please email that email address that Christy is going to share, and we will figure this out.
Somebody asks, is this the first episode of the series? Actually, no, this is actually the 5th episode of our Wellness Wednesday series. Is it the 4th? Fourth episode. Gosh, they go by so quickly. So we have had episodes ranging from fall prevention. We had Dr. Jason Crandall, who shared about an evidence-based program for fall prevention called Bingo Size, which is another program that we offer at Partners in Care. And then we also had somebody from the Torrance Fire Department, a nurse, come to talk about how the fire department is working to decrease falls in the older adult population. We've also had somebody talk about medication management, so from a company called PillMap. And then we've got today talking a bit about diabetes. We do have other exciting topics coming in the next few weeks, so please do stay tuned. Wellness Wednesday, I did forget to mention in the beginning, meets every 2 weeks. So you should be able to see 2 episodes per month. And I do see another question, where can we view the recordings? We have not posted them just yet. Our goal is to actually share out all of our new content first, and then we'll be showing the recordings so that, in case you missed it from the beginning, we can share that with you. Popular question, I saw that. How can we access those previous episodes? Yes, so if you're on the registered listserv, which if you've got the notification for today's webinar, you are, then you'll also receive the notification about when those episodes are posted. We're really excited to share those with you, but we also know that there's so much great content to share. So in the end, we'll have built a great repository of webinar episodes to share with everyone. Any other questions? I'm so glad that we've got some new folks who are joining the series today, and hopefully, you'll stick with us for the series to come. We've got some great stuff coming up. Other questions? I'll keep it open. And yes, you are all very welcome. We're so glad to do this. All right. Well, if no other questions, I know that one of the most popular questions that came in for Christina was, how do I get involved? How do I enroll in the diabetes prevention program? So first, I want to thank you, Christina, for joining us today and for sharing your presentation. I want to let everybody know, if you want more information about the diabetes prevention program or to enroll in a program, you can do it a couple of different ways. So you can visit our website, which you see here at www.picf.org/online-wellness-programs. And if you go to that website, you'll see different program descriptions, including a description about the diabetes prevention program. And you'll be able to type in your contact information and click submit, where we'll get a message and we'll figure out how to contact you with the information that you requested. You can also contact Christina by sending her an email to ebprograms@picf.org. And I'll leave that here for just a second so that everybody can write that down.
I just dropped that in chat also.
Great, thank you, Christina.
You're welcome.
So as I mentioned, we meet for Wellness Wednesday every 2 weeks. So we are going to have kind of a Thanksgiving edition coming up on November 18th at 10:30 a.m. Same time, same channel. And it is going to be a healthy cooking demonstration from the Kitchen Divas, local here to Los Angeles with Black Women for Wellness. But certainly, even if you don't live in Los Angeles, you can join in this virtual space from anywhere. We are so excited to have them. Again, if you have any questions, please do not hesitate to reach out to us. But that will conclude today's episode of Wellness Wednesday. Thank you all so much for joining.
Thank you.
Thank you.
Thanks, Christy.